So let's get started with the 3 types of dietary supplements. So what do we think about when we think about how supplements are made? Well, if you're like me, you're thinking about hipsters. The bearded dudes, right, with a high and tight haircut, probably wearing plaid. He's rocking a smock. You can tell that his mustache is like a source of pride for him, right? And it's about like one little curl away from making him a mixologist at some upscale cocktail bar. So that guy, I imagine him taking the freshest looking herbs that he picks from his garden, and he cares about the garden almost as much as he cares about his facial hair grooming. And you can't even raise your voice near the plants. And if you even say the P word, pesticide, within earshot, you're banned from the house, and he has to uproot the plants and take them to therapy, right? And he then takes those plants out of the ground gently and gracefully at the perfect time, and he manually grinds them in his own little mortar and pestle, one at a time, with love and care. And then it makes you the most beautiful, healthiest looking supplements you could ever imagine. These things are capsules, sure, but they're shades of green and brown and even yellow. Bob Ross would use these to paint his pictures. That's what I think of when I think of the supplement industry. Not really. No, of course not. But we have this weird perception about the industry and how things are made. And when we hear small supplement company, we think of something similar to that, like artisanal supplements almost, right? So like it's not real. And in reality, supplement ingredients come in tubs. They come in big, bright blue, often tubs of chemicals, and they have a label slapped across the front with all sorts of chemical sounding names and the hazardous material designation thing. So it looks like you might as well be making bleach is what it really looks like. And we often villainize the harsh pharmaceutical industry, but this is what the stuff looks like. That's what you get. And inside aren't plants often. Inside are powders. And those powders, it might be a yellow, off yellow, orangish powder for like turmeric, for example. But you don't even know if it's really turmeric at this point because it's just a yellow powder in a drum. Could be anything. And that is the scary part. The supplement industry isn't this small artisanal, mixologist guy working in his own garden. It's a billion-dollar industry, north of $50 billion at this point. And there is an overwhelming number of options. 1994, when, the DSHEA Act, the regulations around supplements was kind of created, we had 600 different companies making 4,000 products. And now we have over 6,000 companies making over 75,000 products. That's exponential growth if I've ever seen one. And these raw materials are coming from questionable sources in unregulated countries. So we can point to China and India, and I don't have a thing against China and India, just that it's often too far for the FDA to go to double check to make sure that everything's being done correctly. And the regulations, it's the landscape that allows for this variation in product quality, and it allows for dangerous products to get into the mix. I often say that it's not big pharma versus supplements. They're the same thing. Supplement industry is big pharma. I've got my graphic, the 14 mega corporations that own your supplement brand, on the screen now for all the video watchers. But essentially, there are 14 major companies that own a majority of the supplement brands that we use. And sometimes they even own competing brands. So, I don't use this brand, I use this brand. Well, they're owned by the same mother company. And so when it comes to this stuff, our bias is really what's coming through. So we have blind faith in this supplement industry. And this is due to that propaganda, the wellness industrial complex, as I've called it a couple times. We have a distrust of mega corporations and big pharma without really knowing that the supplement industry is a part of that gang. And there's so much bias that the frequent atrocities that, I can see happening, and if I have access to it, everybody has access to it. When those things occur, they're frequently ignored. And that's a problem for me. And quality overall is a massive problem. I have lots of different examples. I brought a bunch up on the podcast before. I've got 4 that I'm going to actually talk about right now. The first is CBD. We're going to talk about CBD in another episode in the future. But there are quality issues galore with that. There was a report that said 31% of CBD products were labeled incorrectly. So they had the wrong doses, strengths, ingredients on the label. there was this whole thing with saw palmetto and animal fat. So essentially, saw palmetto is a plant, but the same fat profiles are present in like pig and goat fat. And so some companies figured that out, and they had an excess of pig and goat fat, because what do you do with the fat after you cut up the animals for food production? Well, you sell it to the supplement industry. And so some people were buying saw palmetto, and it was actually animal fats. Now imagine for a second if you were a vegan or a vegetarian or had some sort of religious objection to eating animals. That would be a major problem, and a lot of people didn't know that this was happening. Wellness influencer Gary Null, he's got his own videos and stuff like that. He's out there in the world, but he almost died and almost killed a bunch of people because of his supplement company. The company that he was using did the math wrong on vitamin D, and people overdosed. In New York, there was the Attorney General action against a bunch of herbal supplements. This was a big deal back in 2015, right when we were kind of getting into the groove of our supplement game here. And 80% of the herbs that they just went to the shelves and grabbed some bottles from like different stores, and 80% of them had no active ingredients in them whatsoever. So that's a small sampling of a very large listing of quality-related issues in the industry. And I'll link all of those articles in the show notes so everybody knows that I'm not just talking smack. These are real things that happen. So this brings me to the heart of the lesson, the 3 types of dietary supplements. So if you walk into any store preferably a store that sells supplements, don't go into like a toy store. That doesn't make sense for this story. Just stay with me here, people. And what are you going to see? You're going to see a wall of supplements, if not multiple walls of supplements. And they're just like floor to ceiling, wall to wall. It's overwhelming. There's so many options. How do you pick something? Well, in this situation, let's keep with the turmeric example. We want to pick turmeric. And what we find is 3 different bottles of turmeric, and they are from different companies, so they look a little bit different. How do I know which one is which? Which one is the good one? Is there a bad one? Are they all good? Are they different in any way? And it's really, really hard for us as consumers to look at that and be able to differentiate quite quickly. So here's what I see when I look at those 3 bottles in a supplement store. I don't see turmeric. I see meat. I see a fast food cheeseburger. And then I see a moldy fast food cheeseburger. And that tells you something, because it takes a lot to make one of those gross things moldy, right? But then I see the steak, and that's what we're here for. And again, sorry, vegans, I got nothing better when it comes to this analogy. This one works for me, and if you got something better, write in. Please tell me. I'll change in a heartbeat if I can find something as good. So we think that we're buying this fresh, high-grade steak, the one that we want, and we're willing to pay for it because you know why? Our health is at stake. All right, moving on. So the reality is that we're convinced of this, but we're buying this high quality thing, but because we've done our research and all of that. But in fact, we're getting a fast food cheeseburger. It gets the job done, sure, but it may not be the best for us long term. And that kind of hits on 2 different angles, right? So a fast food cheeseburger, it gets the job done, but it's not really producing the results that we want. That's the first one. And then the second is that by exposing ourselves to this mediocre product, this fast food quality level thing, it's actually going to contribute to our problems long term instead of helping us fix them. And sometimes, which happens far too often, that should be acceptable, the thing that we're buying isn't the steak, and it isn't even the fast food cheeseburger. It's actually a moldy fast food cheeseburger. It's a product that has danger in it, on it, around it. It has either illegal ingredients or contaminants or something in there that won't give us the results that we want. That won't even come close to happening. It's going to hurt us. Taking it on the long term is going to directly contribute to our poor health. So which one are we buying? When I make my choice to buy that supplement, am I getting the steak? Am I getting the cheeseburger? Or God forbid, am I getting that moldy cheeseburger, right? And how would we even know? But the bigger question that I'll pose to y'all is that how would we even know that this was a problem if you hadn't heard this on this podcast? How could we as consumers possibly judge between them and know for certain that we've made the right choice? And finally, the big one, why the hell is this even allowed to happen? We have to understand that not all products are created equally. That's a very important lesson. In fact, we should know that this not only happens, but it happens quite often. So like if we had to think about it, how often does this happen? How often am I getting the fast food cheeseburger versus the moldy cheeseburger? What's the distribution of quality? How likely am I to get a steak ever, right? And so I am sure that everybody's familiar with a distribution curve, which is the bell curve, right? And so you have small on one side, large on the other, and in the middle there's a peak, right? And then you got the two little standard deviation lines up and down, right? So on the left side should be the poorer performing things, and on the right side should be the exceptionally performing things. Very typical, right? Well, supplements are very much like this, but not evenly distributed. And I would say about 10 to 15 years ago, almost a majority of it would be found in the poorer quality range, and very, very little would be found in that upper quality range. So right now we're kind of shifted to the left, and we're broken into three categories. So in the middle is our fast food cheeseburger, what I call the mediocre middlers. These guys are the supplements that are like the equivalent of the fast food cheeseburger. They're all right, but they're really not going to be what you think you're buying. On the right, best in class badasses. These are the ones that are the steak, the things that we're trying to get. And on the left is the dumpster fire grade supplements. Very technical terms that I'm using, and that's the nice part. When you make methodologies like I do, you can just make up words. And I have nobody that pays my bills, so I can say curse words sometimes. It's great. I know what you're asking yourself. Why is this such a freaking mess, right? It's weak regulations and poor enforcement. So like I was saying, back in 1994, there was the DSHEA Act, which introduced this concept of good manufacturing practices, GMP. And that regulates the manufacture of supplements to make sure that each product is pure, potent, and consistent. Very important. But full compliance with that law just happened in 2007. So you could kind of skate around compliance up until about, 15 years ago. The compliance with this law is voluntary, and that's the crazy part, and that's the part that Mark and I are going to talk about, and we've talked about on the podcast before. The FDA is only going to act when you deliberately or dramatically pose a danger to the public. And otherwise, they're not coming to your house. They're not inspecting you. They're not coming. And they don't check each and every formula or product just to make sure that they're going to be safe or effective before they hit the streets. There's no mandatory recall process if your product stinks. It's all voluntary. So you could literally make something that hurts somebody. You can make a moldy cheeseburger, throw it in a pill, and put it on the market. And until you hurt a lot of people, you're not even going to get the attention of the FDA. And when you do, it's not mandatory that you recall it. Most of the actions that the FDA kind of does amounts to just a slap on the wrist. Pretty scary. So there are companies that exist and are selling products right now that just won't shut down. The FDA sent them letter after letter, and they're not doing anything. It's crazy. But more importantly than all of that is that when we talk about supplement quality, we have a limited definition of what quality is, right? So this regulatory definition that's been introduced by the DSHEA Act here, it says that a high-quality product meets labeled claims. That's it. So what does that mean? That means that your product has to be what you say it is, and it has to contain what you say it does, and nothing else. But that doesn't mean anything. It doesn't even have to work. It doesn't even have to get absorbed into your bloodstream. And that, my friends, is the craziest part. That you can be sold a product that literally just passes through into your stool or urine. So here's the final thing that you should know as we introduce this concept of supplement quality. No one solved the problem yet. Some people have tried, but there's no universal rubber stamp for a good quality product. Because I know my reaction when you start to hear stuff like this is like, oh my God, what do I do? And there's no answer. There's no good answer, I guess. So how do we know that something's good, right? What do we do as consumers? Well, there's groups that are certainly trying to help, like USP Verified is a new program, NSF Certified is another. There are third-party groups like Consumer Reports or Labdoor. Consumer Lab is another one. There are trade organizations like the International Probiotic Association or the International Fish Oil Standards Company. But the thing is that it's all fragmented and it's all flawed. But we can use these tools to help us piece it all together But we got to know that it's not a final answer. There's no unified, singular stamp of approval for supplement quality. But don't quit yet. The point is to flip our understanding upside down. We want to make you aware and tell you to beware